Swollen supraclavicular lymph nodes, causes and treatment. Swollen supraclavicular lymph nodes can occur as a reaction to infection or because of metastatic cancer. This swelling typically occurs just above the collarbone. Lymph nodes are part of the immune system. They increase in size due to illnesses like infection, cancer, and autoimmune disease. Sometimes a virus like the flu can cause lymph node swelling that recedes once the virus has resolved. Other times, lymph node enlargement can indicate a more serious condition that needs treatment. This video discusses possible reasons for supraclavicular lymph node swelling, treatment, and when to contact a doctor. Where are the supraclavicular lymph nodes? The supraclavicular lymph nodes are located just above the collarbone. The number and exact position of these nodes can vary, but there are usually more on the left side. One of the supraclavicular lymph nodes is called the Virchow node or VN, named after German pathologist Rudolf Virchow. The Virchow node is usually the left side node closest to the center of the body. However, like the other supraclavicular lymph nodes, the position of the Virchow node can differ from its typical location. What can cause swelling? Lymph nodes are small glands that act as filters in the immune system. The body's cells and tissues eliminate waste using lymph fluid, which travels in vessels and passes through lymph nodes. Inside the lymph nodes are white blood cells called lymphocytes that destroy pathogens. When a person is sick, the immune system produces more lymphocytes, which causes lymph nodes to swell. Cancer. Swollen supraclavicular lymph nodes need a prompt evaluation since this type is associated with cancer. Usually cancer has metastasized or progressed beyond the original cancer site. Approximately 30 to 50% of people with supraclavicular lymphadenopathy. The medical term for swollen supraclavicular lymph nodes also have abdominal cancer. Swollen supraclavicular nodes on either collarbone can indicate a chest malignancy such as lung cancer. If lymph node swelling occurs only on the left side, cancer is more likely in the abdomen or pelvis. This is because lymphatic flow sends chest, abdomen, and pelvic drainage toward the supraclavicular lymph nodes on the left side of the body. Virchow node enlargement is called the Troisier sign that can occur because of stage 4 gastrointestinal cancer. The Troisier sign can also occur due to other cancer types including lymphoma, breast, esophageal, pelvic, testicular. Other causes. Swollen supraclavicular nodes are not always a sign of cancer. Sometimes they can indicate a reaction to an infection. For example, a preprint 2021 case study described a 12-year-old girl who developed supraclavicular lymphadenopathy due to COVID-19 infection. It's important to note that preprint research has not gone through the formal peer review process. A 2019 case report suggested that lymphadenopathy may also be a temporary side effect of vaccines. The report described supraclavicular lymph node swelling in an 11-year-old boy after receiving the human papillomavirus or HPV vaccine. What does swelling feel and look like? Swollen lymph nodes appear as a bump under the skin. Lymph nodes containing cancer cells differ slightly from reactive non-cancerous nodes, and you can see the table to know swelling feel and look like. Treatment. Treating swollen lymph nodes focuses on the underlying cause. Antibiotics can treat bacterial infections, and medications like corticosteroids and immunosuppressant drugs can treat autoimmune conditions. Doctors may use a combined treatment approach if the cause of swollen lymph nodes is cancer. This can include radiation, surgery, and systemic therapy like chemotherapy or hormone therapy to target cancer metastasis in various locations. Doctors may also treat the lymph nodes themselves with radiation or surgery to prevent trapped tumor cells from leaving the lymph nodes and recirculating. When to contact a doctor? Signs that a person should contact a doctor include any supraclavicular lymph node that is larger than 0.5 centimeters, other lymph nodes that are larger than 2 centimeters, lymph nodes that are hard or firm, fixed and not tender, swollen lymph nodes in multiple areas, the person experiencing swollen lymph nodes in age 40 or older. The outlook for a person with swollen supraclavicular lymph nodes depends on the underlying cause. If the lymph nodes swell due to an infection, the swelling should decrease as the infection resolves. Swelling in supraclavicular lymph nodes is often a sign of metastatic cancer. In this case, a person's outlook depends on their age, overall health, and the type and stage of the cancer.